So, very good afternoon, friends. This is Dr. Puneet Samaya, Assistant Professor SJSITS Indore. Today, I'm going to discuss on the topic congestive heart failure. So, first, what is congestive heart failure? So, it is a clinical syndrome which is characterized by impaired structure or function of the heart, which leads to dyspnea and fatigue at rest or with exertion. The pathophysiology of heart failure is complex and therefore there are no single reasons. There can be a multiple reasons. So here you can see there is a I have shown a diagram here. As you can see here, the stroke volume and arterial impedance, there we can plot a graph where you can see the three conditions of a heart. In a normal heart, you can see the stroke volume leads to a increased arterial impedance, but in a failing heart the stroke volume is reduced due to the left ventricular dysfunction or the muscle loss of the ventricles, due to which the arterial impedance is not proper and therefore the blood is unable to pump the proper amount of blood within the body. And the third blue line indicates the treatment of the failing heart with the digitalis, which is a cardiac glycoside, and it improves the heart's force of contraction without increasing the demand of the heart, oxygen demand of the heart. So it shows a positive inotropic effect. Okay, so what is inotropic effect? Inotropic effect is a condition where there is an increase in the force of contraction. Okay, so the digitalis performs positive inotropic effect. Now, what are the symptoms of congestive heart failure? So following are the symptoms like shortness of the breath with activity or when lying down. Then next is fatigue and weakness. Third one is swelling in the legs, ankles and feet. Then rapid or irregular heartbeat. Then reduced ability to exercise and persistent cough or wheezing with white or pink blood tinged mucus and swelling of the belly area or abdomen. Now, what are the treatments? So these are the treatment strategies which can be used for the CHF, like vasodilators can be used, which expand the blood vessels, ease blood flow and reduce the blood pressure. Diuretics can be used, which can correct the fluid retention. Aldosterone inhibitors or antagonists are used, which help with fluid retention and improve chances of living longer. Then angiotensin converting enzyme inhibitors or ARB drugs, which improve heart function and life expectancy. Then digitalis glycosides, which are the most important game changers in congestive heart failure treatment, which strengthen the heart's contraction or they perform the positive inotropic effect. Anticoagulants or antiplatelet drugs such as aspirin help preventing blood clots, and beta blockers improve heart function and change chances of living longer. Then tranquilizers reduce the anxiety. So here I am discussing about the mechanism of action of digoxin, which I told earlier that it is a game changer. So what it does, it improves the force of contraction of the failing heart. How it does? So here in this diagram you can see a single cardiac muscle, or we say it a cardiomyocyte. So here you can see this is a membrane. The membrane, various type of protein channels are present, like sodium potassium ATPase pump, then NCX, which is sodium calcium exchanger, then voltage gate calcium channels are there, invert calcium channels, and the calcium ATPase pump. These four things are present in the cardiac cell. And what it does, so sodium potassium ATPase pump, what it does when it is activated, what it does, it transfers the potassium in and lets the sodium out of the cell. And as a result, what happens, the sodium from NCX comes inside and the calcium is given out. Okay, and for this the more calcium is transferred from outside to inside from the voltage gated calcium channels, and this calcium is also exchanged with the help of two hydrogen ion. So as a result, what happens, this calcium, what it does, when this calcium is inside the cell, it contracts the heart muscles by sliding actin on myosin, and when it is not available, then there is a relaxation. So our strategy is to increase this force of contraction by means entrapping the calcium within the cell, so that more amount of contraction is there inside the cell. So as a result, you can see when this digoxin is bind to the sodium potassium ATPase pump and it blocks this pump. So this pump is blocked. So as you can see, the sodium is entrapped inside the cell, and as it is entrapped inside the cell, so it blocks the sodium calcium exchanger. uh, as a result, the calcium cannot move out of the cell and it is entrapped inside the cell, and as a result it leads to the contraction of the cardiac muscles, and which increase the positive inotropic effect of force of contraction. So this is all for today. Thank you so much.